Hey everybody, it's Gypsy, and today is Wednesday, May 2nd, 2023. And because it's Wednesday, it's an update on my recovery for my Tibia Plateau surgery because it's been exactly 13 weeks today that I had my surgery. So I'm going to do an update, and then I'm going to continue telling you my story of what happened to me. Last week I talked about the first 24 hours and how I fell and how everything came to pass. So anyways, this past Friday, I went to see my orthopedic doctor, and he gave me the go-ahead to start putting weight on my left leg, which is the one that broke and shattered. So, excuse me a minute. I started Friday after I got home from the doctor to put just the slightest amount of weight while using my walker. I was just putting my toes down with a little bit of weight. I would say by, I don't know, Saturday night or Sunday morning, I had, without even thinking about it, started using the ball of my foot and putting slightly more weight. What I did find, if I put too much weight, my knee would buckle. Now, it is painful. Also, my leg is extremely weak. After over 12 weeks of not using it, I was doing my PT exercises, but not putting weight on it and using it to walk, it had atrophied. But since then, I'm putting a little bit more weight every day. I'm still only using the balls of my foot. But my gait is kind of turning into more of a walk. The more I'm doing it, it's like I need to practice. Yesterday, I had an appointment for assessment for physical therapy in home. And they're going to be calling me today or tomorrow to set up my schedule. And I will be having physical therapy twice a week at home to help me relearn how to walk. Let's see. So yeah, that's basically where I am. I'm getting a little better every day. It hurts, but that's okay. As long as I know I'm not doing anything that would cause harm to my leg, it's fine. It's gonna hurt. It's just natural. It's gonna hurt, especially around my knee. Let's see what else. So yeah, physical therapy. Also, I've been looking for a cane, looking at canes. I found some really beautiful ones because I was told I will be going from my walker to a cane. So the wheelchair I'm still using for long distances when I go out, which is rare that I go out. I'm hoping that changes soon because I'm bored. And I'm hoping to get rid of the wheelchair real soon. So I have a few different beautiful canes that match my personality picked out, and I'm going to order my cane. The hardest part is finding one short enough. I know I found some places where they customize the height, and I'm going to need that because I think I need one about 31 inches. I'm going to have to measure first, but for me, that sounds about right. Canes that are not customized size-wise, seems like 36, 34 is the shortest. Sometimes you can find 32. So I'm going to have to go with someone who can customize it for me. So I'll be doing that. Right now, I can drive because I can bend my leg and sit forward in a vehicle now. I couldn't do that for a very long time. My problem is the wheelchair, because I cannot go long distances on the walker yet. That's coming soon. The more weight I can put on my leg and the better I'm walking, the closer I am to not needing the wheelchair anymore. It's the wheelchairs that's the problem, because when you cannot fully use one leg, you're off kilter. And to take that out of the bed of the truck and then unfold it and, putting it in, that would be, I feel like I'd be putting myself in danger doing that. So if I do drive, I have to have someone with me. So anyways, that's the update. My updates are getting, shorter and less impressive. My doctor was impressed that I can bend my knee 90 degrees. I wasn't impressed because I had wanted to be able to bend it all the way back by then, and I'm still stuck at 90. There's something about the 90 that just, I can't get past it. So anyways, I told you last week that I did have the emergency surgery, and it was much longer than I had thought it would be. I thought it would be an hour, hour and a half, and I'd be, I'd be back in post-op. When I got to post-op, I found out the surgery was more like 4.5 hours. I was surprised, and the doctor told me, well, when he did the scan and then opened up my leg, he found out the bone. I slammed my knee joint together and the bone shattered. So he had to pick out all the shards and then glue my bone, my tibia, back together. So I had reconstructive surgery first before he put the plate in, which is why my scar is so much longer than what he had originally. He told me it would be on the side of my leg about this big. Well, it's much longer than that. So, after that, it's really hard for me to remember. I've had people tell me that we had conversations or they told me something within a few days after surgery, and I can't remember it. It's really embarrassing. They had me so drugged up because the pain of this injury is like nothing I have ever felt before. And yes, that does include natural childbirth. And I know it's been 25 years since I've experienced natural childbirth, but this, man, it hurt a lot more. But they started me with fentanyl. They kept giving me morphine every once in a while and lots of oxycodone a lot. And like I told you, they just recently weaned me off of that. Friday, my doctor gave me a little bit of tramadol. He prescribed that. He told me to take before and after physical therapy because it's going to hurt like hell. I do take Tylenol, but Tylenol doesn't do much. Not for pain like this. But anyways, what happened was my surgeon in New Mexico, he wanted me to go from the hospital to a rehab hospital for physical therapy and occupational therapy. And then he wanted me to go from there to a skilled nursing facility for more occupational therapy. And then he wanted me to have in-home occupational therapy. Now, my insurance company gave him a hard time. I guess the way insurance companies see it is that once you get to a point in your physical therapy where you can't go further, they don't want to pay for it. So, and that does make sense to me. Because I was non-weight bearing for 12 weeks, I had reached a point where they couldn't do any more occupational therapy that would benefit me until I was able to bear weight and start working and walking, which is why I was just getting occupational therapy recently. So now I'm going to be starting physical therapy again. So I ended up being in the hospital where I had my surgery for 6 days. The reason was, I guess, one, well, they want to make sure I was okay to be released. Two, my doctor was fighting with my insurance company because they didn't even want to put me in a rehab hospital from the hospital. There were, I was told, about 3 rehab hospitals in the area my insurance company would only cover one, and it was the furthest one away. The hospital was in Rio Rancho. The rehab hospital they sent me to, and the only one my insurance company would cover was in Albuquerque. So I spent 10 days there. Now, what they taught me to do there was to hop on one leg with a walker. This is not easy. Now, I have gotten better at it, but it is very exhausting, and you cannot do it for very far or very long. But what happens is, they record how far you go with each session. Now, this makes sense. However, what they put in the notes is that you're walking. And I'm like, this isn't walking. To me, that's not walking at all, and I think that needs to be rephrased. If I could walk, well, then there wouldn't be an issue, and we wouldn't have to make these notes, and I can walk as far as I want. But with hopping with the walker, I could go maybe 70 feet, but I had to have at least 3 breaks. Within that 70 feet, I'd have to keep sitting down and resting. So I couldn't do it straight through, and I was hopping, not walking. So when they released me, they kept insisting I could walk, and they told my insurance company this. Now, the day before, my insurance company told them that they were not going to cover me any further. You can't leave yet. You can't walk. You can't do this, etc. Now, what I have found with these rehab hospitals and skilled nursing facilities is they will keep you forever as long as your insurance company will cover it, whether you need to be there or not. Now, I came across a lot of patients who love being in these facilities and would make up every excuse to be there. I'm not one of those people. I want my life back, and I don't want to be in a hospital or any kind of medical facility. I don't like it. I'm a very independent person. I like doing everything for myself, so I've been having a real hard time with this. So anyways, one day they're telling me I can't leave. They give me a hard time about that because, one, I don't have an appropriate place to go to. The way I live and my trailer would not accommodate my injury, especially for how long it was going to take. So they said they couldn't release me because of that. They had to figure out, where I could go to live safely. You can't walk, you can't do this, you can't do that. Well, 24 hours later, they hear from my insurance company, all of a sudden I can walk. Now, my son and daughter-in-law come to pick me up, and before we were leaving, I decided to go to the restroom. We were in my room. My bed was right near the bathroom. So I hobbled over with my walker, hopping on one leg. It took forever for me to get there and then get into the bathroom. And, it's a big to-do when you are, an invalid. Simple things aren't simple anymore. It's really like an acrobatic process just for me to use the restroom. So my son watched me go into the bathroom. And I closed the door, of course, because my son was there. But as we're leaving, this doctor who had never taken care of me before, I didn't even know who he was. Oh, Michelle, we were just talking about you in the meeting. And I said, well, why? About what? Oh, that you can walk now and you're going home. And I looked at him like he was nuts. I don't call that walking. And my son was like, he just put his hand up. He's like, wait, I just saw my mother go into the bathroom. That was not walking. If you're going to tell me it's walking, I'm not talking to you. Let's call it for what it is. It's not walking. When I say I want to walk, I want to use both my legs like I used to, okay? Now, I've had trouble with my left leg all my life. I've had pain. I was born with a dislocated hip. I was in a body cast, armpits to toes, from 6 weeks old to 6 months old. Okay? So, walking especially if the weather's wet and cold, it's been difficult for me, but I was walking. Hopping on one leg with a walker is not walking to me, and I really couldn't go very far. And they're like exaggerating, and it was like I looked at my son and my daughter-in-law like, it's a miracle, I'm healed. All of a sudden I can walk, I'm healed. I mean, it's so aggravating. Just tell the truth. I know I can't walk. Believe me, this is not the place I want to be, so don't tell me I can walk. This is not walking to me. So anyways, I was released from the hospital that day. Now the plan was, because it was not safe for me to live alone, my son and daughter-in-law are long-haul truckers, so they're going across the country all over the place, 24/7. They had to take a lot of time off of work to do everything they needed to do, because the plan was to get me back up to Ohio where I have family and friends and appropriate, safer places for me to live while I'm healing. So I had to learn how to get in the back seat of my own truck, which was, whoa, was that crazy. I had to buy a bench. I had to hop in backwards on my good leg onto the bench, then onto the running board, and pull myself across the back of the seat. Now back then, my brace was locked, so I could not bend my leg, so it had to be straight. So they set up a bed for me in the back. So first we had very quickly teach me how to do that, and my son and daughter learned to help me. So they called my prescriptions in to a Walmart that we were going to stop at on the way up to Ohio from New Mexico. It was nearby, maybe half an hour away. So we get there. My son goes in to get my prescriptions. Comes out, he goes, this isn't all the prescriptions. He goes, Mom, your pain medication is missing. He goes back in, and the pharmacist says, oh, I've been trying to get a hold of the doctor all day. This is a high dose of oxycodone, and I can't just give it out. I have to make sure that this is correct. So I need to talk to the doctor, and I've been waiting, and he doesn't call me back, and I've been trying to call him. So my son comes back out. He's trying to call the doctor. I'm trying to call the doctor. The pharmacist is trying to call the doctor. And there was like no way to get to the doctor, first of all, because, of course, you can't have a real person answer the phone, nor could you get to one. So we decide to turn around, drive the half hour back to the hospital to see if we can get this taken care of. But it's after hours by then, so it's like office people aren't in. But in the meantime, I don't know how my son did it. He talked to the doctor. And the doctor's like, oh yeah, I'll call the pharmacist right now. So we say, okay. We had to stop at a gas station, so we stopped there. In the meantime, my son calls the pharmacist, and he says, I talked to the doctor. He said he was going to call you. Did he? She goes, no, I haven't heard from him. And she's like, well, this is getting ridiculous. She says, may I ask why your mother needs such a high dosage of oxycodone? So my son says, well, my mom fell. She fractured her tibia plateau and, shattered her knee joint. And she had emergency surgery. And the woman went, oh my God. She goes, I'm so sorry. She says, you know what? I'm just going to go ahead and fill this. So we had wasted an entire afternoon because we should have been, well, probably out of New Mexico by this point. And we drove back to the Walmart, finally got my medication. So we're driving. We stopped at this one place, and it felt like the brakes, we were hauling my trailer back to Ohio because we didn't want to leave it there. It wasn't safe to leave it on my property in New Mexico. So we were taking back up here. we're at this one point and we're pulling out of this parking lot, and the brakes of my trailer sounded like they were grinding or something. And, you know, my son and daughter are truckers, so they kind of know what to look for. They really couldn't see anything wrong. And my son slowly drove it around this parking lot. Well, all of a sudden it started driving okay then. So we're thinking, okay, something got stuck up in the axle or into the brakes, a rock or something, and it came out. And it drove fine after that. But we were exhausted and aggravated. You know, and we were just way behind schedule. So we got a hotel room in the middle of the night. You know, and I'm not well, you know, so I was feeling like shit. And we slept. Now, the week before, when my son and daughter-in-law stopped at my property to pick up some of my stuff, they had a problem with my truck not starting. Sorry about that. My camera just did something really weird and stopped. It was like one Murphy's Law thing after another the entire week. So we get back on the road. This is Saturday. All day long we drove. We had planned to stop and have dinner at the barbecue place in Kansas City that we all love so much. And the sun is going down. We're driving down the highway, and I tell my son and daughter, oh, this is great. We've had a great day. Nothing bad has happened. And my son goes, shh, Mom, don't say anything. You'll jinx us. About 9:30 p.m., we're an hour outside of Kansas City. We're going to stop for dinner. All of a sudden, we hear this big bang. My son looks back, and sparks are coming out from underneath my trailer. So we had to pull over the side of the highway. The axle broke. So it wasn't that something was stuck in the trailer. The axle was breaking. So we had to leave it on the side of the highway. It took about 3 or 4 days to find somebody to tow my trailer to a place to have it fixed. Because you can't just tow a trailer like you would a regular vehicle. So it had to sit there. So they did finally, we had to get a hotel just outside of Kansas City, and the next day we went for lunch at this place. But we drove back without my trailer because it's in a place where it's getting fixed, and it's still down there. Because let me tell you, when you're an RVer, you know this damn well. You take your rig in to be fixed, it could be months before it's done. So all of my worldly possessions, including clothes, everything, is in my trailer in Kansas City as we speak right now. So, we leave Kansas City. It was a horrific trip. And we are all like, my immediate family, like my 2 sons and me, my ex-husband, we're all like into traveling, so we're used to it. But we'd never had a trip like this before. It was awful. So we finally get back to Ohio. We're there about a week trying to figure out what to do, bebopping from hotel room to hotel room because things just weren't working out. Where are we going to put Mom? What's going on with Mom, etc. I ended up going to an emergency room because not only was my leg really swollen and painful, I felt sick. I didn't feel good. So I go to the emergency room at Metro Health Hospital in Cleveland. They find out, well, I have a blood clot in my leg. So that's that portion of my recovery. Next week, I will talk about, further on. So anyways, this is week 13. I can't believe I never thought it would get here. And I'm learning how to walk. So I'm going to leave you with that. Blessed be, and make it a joyful one.